Dr. V.K. Paul, Member Health, Niti Aayog, Dr. Rajiv Behel, Secretary DHR and DG ICMR, Ms. Anu Nagar, Joint Secretary, and Srimati Manisha Saxena, all our distinguished scientists, researchers, industry partners, and other delegates, the heads of the institutes who are present here on the occasion. My warm greetings to all of you. It's a very auspicious day. While we host the second edition of the Health Research Excellence Summit 2025, we're also commemorating 114th Foundation Day of the ICMR. And on this occasion, I extend my warmest greetings to all who are part of this very, very exceptional event. Ladies and gentlemen, it's indeed my privilege to join this gathering which celebrates the strength of India's scientists, innovators, and healthcare professionals who transform research into hope for millions. And we all know that under the visionary leadership of our Prime Minister, Shri Narendra Modi ji, today India's health research ecosystem has strengthened and it has become a very important pillar of Viksit Bharat, which is driven by Atmanirbharta, self-reliance, innovation, as well as equity. And today's summit stands as a testament to this vision that the true measure of science lies in serving humanity, strengthening systems, as well as shaping policy. Over the past decade, India has emerged as one of the most dynamic global health innovation ecosystems. And through the mission mode initiatives under the DHR ICMR, we are not just, we are addressing our national priorities, which range from antimicrobial resistance to rare diseases, to climate-related health risks, and also One Health Preparedness, which is one of our very, very important missions. ICMR's ecosystem of the Centers of Excellence, the Intent Clinical Trial Network, and the MedTech Mitra. They have nurtured more than 27 indigenous medical technologies, accelerating affordable innovation from bench to bedside, from lab to the real-life settings. From Rotavac and Covaxin to TrueNat TB diagnostics, India's research institutions have shown how public-private partnerships can turn discovery into delivery, reinforcing the spirit of Sabka Saath, Sabka Prayas, Sabka Vishwas. The first dimension of science is for the people. Innovations that touch lives at the community level. And this pillar translates research into real-world impact for communities as well as the marginalized groups. I'm glad to have launched today the Assistive Technology Guidelines and the Assessment Kit, which is jointly developed by IIT Delhi and All India Institute of Medical Sciences, Delhi, and with the financial support of ICMR. This indigenous kit will help clinicians and therapists assess the upper limb functions with precision and provide better rehabilitation care. The National List of Essential Assistive Products, developed jointly by ICMR and the Bureau of Indian Standards, is another very important milestone, setting national benchmarks for accessibility as well as inclusion. These initiatives reflect the government's commitment to ensuring that the benefits of science reach every single individual, including persons with disabilities, enabling them to live a life of dignity as well as independence. We also unveil the ICMR's Pensioners Portal today, a simple yet powerful step towards the institutional compassion. It embodies transparency, efficiency, and respect for the scientists and staff whose services continue to inspire generations. Friends, the second pillar is Science for Progress, which is strengthening India's innovation pipeline and translating research. This segment celebrates India's rising self-reliance in biomedical innovation and technology development. The MedTech Mitra's Innovators Guidebook for In Vitro Diagnostics is a landmark effort to handhold our innovators, from the laboratory to the marketplace. It demystifies regulatory pathways, encourages indigenous design, and strengthens India's growing medtech sector. The 11 new indigenous technologies which have been developed by ICMR institutes have been transferred today to the industry, which is a significant step in translating laboratory excellence into the real-world solutions. The RT LAMP assays developed by ICMR NIV will offer low-cost, instrument-free rapid test for Nipah, monkeypox, and SARS-CoV-2 virus. The 4 advanced molecular and immunoassay platforms for measles, Japanese encephalitis, KFT, and influenza will strengthen the infectious diseases surveillance as well as preparedness. Similarly, the CRISPR-based diagnostic kit and the DNA test developed by the ICMR NIRT is a breakthrough early detection tool for tuberculosis. A major step has been taken in timely differentiation and management of co-circulating arboviruses through the development of RT-PCR assay for simultaneous detection of dengue, chikungunya, and Zika viruses. Together, these technologies reflect the nation's ability to not only innovate but also deliver at scale, ensuring timely detection, preparedness, and public health security. These advances illustrate how Make in India meets Heal in India, where innovation and impact converges to strengthen public health security. Coming to the third dimension, which is science for policy, strengthening the link between evidence governance as well as healthcare delivery. Evidence-based policy making remains the foundation of good governance as well as public trust. And the ICMR clinical workflows for the community health officers will operationalize comprehensive primary health care under the huge network of the 1,75,000 Ayushman Arog Mandirs. With this tool, every health worker from the sub-center to the block level will be guided by evidence-based protocols, ensuring uniform quality of care across the country. The revamped Standard Treatment Workflows website. This marks another important reform. It consolidates clinical guidance, integrates digital usability, and ensures that quality standards are accessible to every healthcare provider, both public and private. Such platforms demonstrate India's commitment to data-driven governance and scientific policy making, thus making healthcare more reliable, accountable, as well as future-ready. Today, we are celebrating those who make this journey possible. Our scientists, innovators, and most importantly, the administrators. The DHR ICMR Health Research Excellence Recognition 2025 recognizes the extraordinary achievements across the intramural and the extramural research, technology development, patent creation, as well as scientific review. Each recognition symbolizes years of dedication, collaboration, and silent perseverance, the very spirit of Indian science. So to all those whose excellence has been recognized today, I convey my heartfelt congratulations. Your work is not only building knowledge, but it's building national capacity and global credibility. Today, India's health research system stands at a defining moment. As outlined in the DHR's vision for Viksit Bharat, our goal is to position our National Apex Medical Research Institute, Dr. Paul said 3, but we've decided. Now let's decide whether it is going to be top 3 or top 5. Global health research agencies driving equitable innovation and policy impact. The next decade will see AI-driven diagnostics, precision medicine, climate health analytics, and One Health frameworks redefining the way we understand and respond to the disease. Regional laboratories of the National Institute of Virology and the BSL labs are being expanded for pandemic preparedness, rare disease therapeutics and AI-enabled screening tools are today becoming national priorities. The DHR ICMR network must continue to act as the nation's transnational engine, where research meets policy and policy meets public good. Every discovery, my friends, must aim for implementation, and every innovation must advance inclusion, and every policy must be grounded in scientific evidence. As Honorable Prime Minister Narendra Modi ji often reminds us about Sabka Prayas, collective effort, of institutions, innovators, and citizens, that is the key to realizing the vision of Viksit Bharat by 2047. So before I conclude, I commend the DHR and the ICMR team and the scientists behind today's launches for their dedication and service to the nation. Let us remember, when research becomes relief and innovation becomes inclusion, that is when we truly serve our countrymen, the people of India. When every health worker is empowered with science and every citizen benefits from it, that is when we achieve Sabka Saath, Sabka Vishwas, and Sabka Prayas. Let us continue to work together with compassion, courage, and conviction to ensure that India contributes to global science, but also leads it with purpose and pride. With this, I thank you all very much. Jai Hind.
Our earnest sense of gratitude to express how privileged and honored we are to embrace and inherit